We can all point to moments in our lives which we regard as milestones. Events which set us on a different path and made us reevaluate what we thought we knew. In my professional life, HIFA was the milestone. In 2007, I was working for the International Department at the British Medical Association. I was leading a project to build the BMA's capacity to improve health in low and middle income countries. In late November of that year, I was the last minute replacement as host for an external meeting at BMA House. Now, in hindsight, I was sitting in on what was probably a typical HIFA steering group meeting at the time. But that's not to say that it was low key. Far from it. Energy, ideas, knowledge, experience, the room buzzing with possibilities, all centred on the lack of access to healthcare information, tens of thousands of avoidable deaths every day, even though the interventions were locally available. Why haven't I heard of them before? I thought. Eventually, I raised a tentative hand. Who is your main funder? I asked nervously. We don't have any funding, replied Neil. Having absorbed that, Neil and I submitted an application to the BMA at the end of 2007. And in 2008, we were awarded £15,000. So I lost no time in getting the BMA's International Committee on board, and they immediately gave full support to HIFA and asked me to deliver a report on our progress at every meeting, which I did. I was then invited to Brussels, where I gave presentations about HIFA to European medical organisations, 3 of which became and still are supporting organisations of HIFA. In 2011, I was very, very proud to host the first HIFA conference at BMA House, bringing together HIFA members from across the world. And then, as Neil has said previously, in 2015, the BMA's annual meeting unanimously approved policy endorsing HIFA, and shortly afterwards, Lord Crisp tabled a parliamentary question about HIFA in the House of Lords. I recall that one senior BMA figure remarked after hearing me give another progress report packed with things that we'd achieved. HIFA doesn't have a reverse gear, does it? Just a forward one and an accelerator. I've since left the BMA, but I still work with HIFA. HIFA both inspired and supported me to become a freelance advocate and writer on global health. That's what HIFA does. It brings the best out in anyone who gets involved. If I was still at the BMA now, I'd be answering questions from members about Brexit. I think I made the right choice. People are still dying for lack of healthcare knowledge. We know at HIFA that we can end this preventable crisis. But as Nina's also said, our problem is capacity. Whilst we have many volunteers who give generously of their time, we need to raise sustainable funding to expand our team and ensure that we achieve the HIFA vision, a world where every person worldwide has access to the healthcare information that they need to look after their own health and the health of those for whom they are responsible. I hope you'll feel as inspired tonight as I did back in November 2007. The momentum is getting stronger all the time. Get involved in every way you can. You really will not regret it. Thank you.